laboratory reports. So you will be provided, or you will be given some reports. You have to analyze the report, and you have to answer certain questions. This is one of the questions for your practical exam. So first we will be taking one CSF examination report. So before that, we will just have a look what is the normal CSF level. I mean the report. So normal CSF analysis, when you take, you just see all these things only. A lot of things are there. The lymphocyte, the cells will be only 1 to 5, maximum 5. That is in the normal case, 5 per histopathological view. Then protein, it will be 15 to 45 milligrams per 100 ml. And glucose, it is about 60 to 80% of the normal glucose level. That is around 50 to 80 milligram per 100 ml. Okay, these three you can remember. Lymphocytes or the cells, it is only up to 5. Normal level I am telling. Protein, it is 15 to 45. Glucose, 50 to 80. So this is the normal CSF level, and there won't be no pathogenic organisms in the CSF. So this is the normal microbiological examination, normal CSF analysis. Then we will have we will see what happens in different conditions. That is meningitis, different types of meningitis. It can be bacterial, viral, fungal. So normal already I have told. Then bacterial meningitis, the color appearance will be, otherwise it is clear. So bacterial meningitis, it will be turbid. And viral and fungal, it will be clear. Okay. Then pressure, it will be elevated in bacterial as well as fungal. Viral, it may be normal. Then WBC, I have told it is 5, or that means less than 8. But bacterial meningitis, it will be elevated. So you can see 1000 to 2000. It's very high. Viral meningitis, it may be elevated. There will be lymphocytic predominance, and it will be less than 300. Fungal also less than 500. Protein, you can see normal 15 to 45. It is very much elevated in bacterial meningitis, but it is less than 200 in viral and more than 200 in fungal meningitis. Here also bacterial also it is more than 2. So it is elevated. Protein is elevated. Then glucose. Glucose, it is usually 50 to 80. Bacterial meningitis, you can see it is reduced. So glucose, it is reduced. Whereas viral and fungal, it will be normal or normal to low. So bacterial, it will be turbid, elevated, pressure will be elevated, WBC will be more, then protein will be elevated, but glucose will be less. Okay, so viral, it is clear, the glucose will be normal, fungal also it is clear, glucose is normal, and protein will be elevated. So I think you have followed that. So we will now see this report, and we have to, one of you can, who will analyze the report. 1 minute, I'll just take. Sorry. Can you see the slide now? Didi Devadas, can you see the slide?
Yes, ma'am.
Okay, in between there was some net problem. Okay, Didi, then you can read this question. So just read the question.
6-year-old weighing 30 kilograms, fever, headache, and vomiting. On CSF examination, appearance was turbid. Total count 2000. Differential count polymorphs 90, lymphocyte 10, proteins 80 milligram per
100 ml.
deciliter, glucose 10 milligram, gram stain, gram negative bacilli.
So what is the CSF report about? We have already, and I think when I was discussing the normal, this thing, you were able to see, no? That time you were
Yes,
able to, okay. So then please tell me, so this CSF is of what condition? Appearance is turbid and total count it is 2000 cells. Okay. Proteins, no, I'll just say appearance, is it okay? Is it normal?
no, ma'am.
Yes. So it is turbid. Total count, is it normal? Total count. How many cells I told it will be there in normal CSF? Huh?
W cells are less than 8.
Less than 8 or less than 5. Okay, 5, up to 5. Then proteins, is it elevated here? What is the normal protein?
1.5 to 4, 15 to 45.
So this is elevated here, isn't it? Glucose, is it elevated or reduced?
Reduced.
Reduced. And the gram stain, it is gram negative bacilli. So this picture is about the CSF examination. Now, if
bacterial meningitis.
Yes. So it is a bacterial meningitis. The glucose is reduced, protein is elevated, cells also it is increased. So it is a bacterial meningitis. And this patient is 6-year-old. This is a baby. It's a child. So, and they have identified gram negative bacilli. So what can be the bacteria that is usually seen in a 6-year-old child that causes meningitis? Any bacteria? You tell me any bacteria. Gram negative bacilli. Okay, no problem. I will ask someone else. Shamima Rishana. Shamima.
Yes, ma'am.
So what can be this gram negative bacilli that is isolated? That is a 6-year-old child. So that causes meningitis. So which can be the gram negative bacilli? Any idea? If you say yes or no, say. If you know the answer, tell.
No, ma'am.
No. Okay. Then we will go. So it is Haemophilus influenza. So the question will be like this. It will be the question: interpretation of the analysis and management. So she has already, Didi Devdas also has told. She has told that it is bacterial meningitis. It will be, because it is a child. It can be Haemophilus influenza, and the drug can be any cephalosporin. So, and if there is meningitis, there may be cerebral edema also. There is around the inflammation, there will be edema. So to reduce the edema, we have to give some steroids like dexamethasone. So you can, I think you can, from this part, from here itself, you have to write. Those are, you can write it in your notebook, because this question may not be in your record. So you have to please write it down, then we'll come to the answer. The last pages of the record, you can see there is the space for laboratory report. Those are having records, you can write there, laboratory reports. Once you finish this page, please, one of you can tell me, is it over? Yes. Is it over? Didi Devdas?
Yes, ma'am.
Yes. So next page, the question will be interpretation of the analysis. Second question, it is management of the condition. Please write down the question. Interpretation of the analysis. Second point, it is management. So interpretation, it is Haemophilus influenza meningitis. H influenza. And the drug will be injection. It is a cephalosporin, cefotaxime, 200 milligram per kilogram per day, 6 hourly for 14 days. 14 days. And injection dexamethasone, 0.8 milligram per kilogram BD for 2 days. This is to reduce the cerebral edema. Why I have written here? Because this is a what is the weight of the child? It is 30 kg. So cefotaxime 200 milligram per kg. So 200 into 30. That is, it will be 200 into 30. How much? 6,000. So 6,000 6th hourly. 6th hourly means 4 times. So 6,000 by 4, it will be 1,500. So that is why it is written 1.5 gram of Q6H into 14 days. And dexamethasone, this much. This is the answer. Please write down. Have you written? Shamima, have you written? Hello, Shamima Rishana.
Yes, ma'am.
Over. Okay. So now we will see next question, urine analysis. Urine. Write down. This question you just write down, then we will discuss. Urine analysis, color. Urine color, it is turbid. pH, it is acidic. Microscopy, pus cells 20 to 30 cells per cubic millimeter. RBC nil, bacteria 3+, culture and sensitivity, heavy growth of E. coli. Please write down. Over. Shamima, have you written? Yes or no? One of you can.
Yes.
Yes. So one of you can tell me when it is over. Okay. Fossil. Fossil is there, no? Fossil. Fossil MH.
Ma'am. Yes, ma'am.
Yes, please. This have you written?
Yes,
Yeah.
ma'am.
Yes.
Okay.
What picture about? So this is color. It's turbid. Puzzles, bacteria, culture and sensitivity. So what is this? What is this report? A patient is having this is analysis of a patient. So what does it show? What is your diagnosis?
Ma'am, bacterial.
Bacterial. Bacterial. Complete it.
Meningitis. But urine analysis. Sorry, ma'am. Urine analysis.
Please. The heading is urine analysis. So it is bacterial. Hello.
Don't know, ma'am.
No, you have to tell me. So bacteria is there, pus cells is there. So what is the condition called? Why are you telling don't know? Tell me.
Bacterial infection, ma'am.
Bacterial infection. So the infection that is happening in the urinary tract. So what is it called? It is urinary tract.
Urinary tract infections.
Yes. So urinary tract infection. So why did you say this is urinary tract infection or infection? No, if the bacteria was not there, is a diagnostic of urinary tract infection. Suppose this report was not there, bacteria plus, only this much it is there. So can you diagnose from this?
No, ma'am. Bacteria should be.
Should be there. No.
Yes, ma'am.
Then I'll tell you. Okay. So because normally the urine color, it is sometimes it may be clear or pale yellow, isn't it? But you see the color is turbid. So that is suggestive of infection. Okay.
Okay.
Number two, it is pus cells. Pus cells usually up to 5, it may be there because we can allow that. But here it is 20 to 30 cells. So that itself, it is another point showing that it is infection. So if you are having this much only, you can diagnose in the sense you can assume that it is having some infection. Then you send the urine for culture and sensitivity. And then this bacteria also you can see under microscope, but which bacteria that has been identified by the culture and sensitivity, and it has found out that it is E. coli. So like this, and if the suppose if there is RBC, now it is nil, but if the RBCs were there, some 0 to some 10 cells, if it was there, then there are different conditions. You can go for pyelonephritis, or you can say that it may be due to some urinary stones. So all these things you will study in the clinic, but just remember, if RBCs are present and the person is having some urinary colic, something that is renal colic, then you can think of some renal stones, then you go for some ultrasound abdomen, and there you will find the calculi also. So like this, whenever you see one urine analysis, you can come to a diagnosis. The final, the bacterial confirmation is by culture and sensitivity. Okay. Okay, then okay. Good, Fasil. Now, who can answer? Femina Najib. Femina.
Yes, ma'am.
Yes. So there is heavy growth of E. coli, and this is a urinary tract infection. So what drug will you give?
Fluoroquinolones. Fluoroquinolones.
Yes, fluoroquinolones. Very good. Which fluoroquinolone you will give?
Ciproflox.
Yes, we can give Cipro, but nowadays people are giving norfloxacin. So that is the drug we will give, norfloxacin. And for any urinary, because it is having less side effect, and it is very effective in urinary tract, and it is also a fluoroquinolone. So norfloxacin we will give. So the question is, okay, please write down. I think you have already written down. Okay. Now the question is interpretation of the analysis, management. First question, please write it down. Interpretation, second, management, and third, what is the favorable urinary pH for fluoroquinolones? So these 3 reports, one more report is there. So these 3 reports, it will be there for your university exams also. Same questions will be asked. So please study. Okay. So these are the 3 questions, and we will get the answer. So you have already told it is a urinary tract infection. And management. So in any case of urinary tract infection, so we have to give plenty of oral fluids, and we have to give the drug norfloxacin 400 milligram twice daily for 5 days. So it is a lower urinary tract infection. So 400 milligram BD into 5 days. Please write down plenty of oral fluids also. Plain water, that is enough. Plain water. Then the third question was, what is the favorable urinary pH for fluoroquinolones? It is always, it is in the Tripathi, you can see there is a tabular column where you can find out the different pH that is necessary for each antibiotic. So for fluoroquinolones, it is alkaline pH. So how can you make the urine alkaline? We can use by giving potassium citrate syrup, 15 ml. It has to be diluted with 200 ml of water, and it has to be consumed 3 times daily. And also it will inhibit the irritation of the bladder mucosa also. So by alkalinizing, it is favoring the action of norfloxacin, or because it is a fluoroquinolone. Okay. So whenever a patient comes to you with urinary tract infection, simple treatment, plenty of oral fluids, norfloxacin, and giving potassium citrate. There is a syrup called Citralka. It has to be 1 teaspoon. We have to mix with 200 or 100 ml of water, and we have to give 3 times daily for 5 days. So he will be cured of his urinary tract infection. In future, you will be seeing a lot of people with urinary tract infection, mainly both male and female, but females, more in females. And this is the simple treatment. But this is an empirical treatment. So if you do the culture and sensitivity, the correct drug you will find out, and that can be given. But in places where there are no facilities for culture and sensitivity, you can give straight away norfloxacin. It is an empirical treatment. Please write down. And once you finish, one of you can tell me it is over. Yes, have you finished writing? Okay. Who has ended the name? One minute. Who is this Shasil Aman? Who is that? Hello. Who has joined us? Shasil Aman. Hello. Who is this?
Yes, ma'am.
Who is that?
Sarjata Nargis.
Who? Oh,
Sarjata Nargis.
Sarjada. Okay. So, okay, no problem. You can change the name also in your this thing if you want. And in the chat box, you write your correct name only.
Yes, ma'am.
Otherwise, you won't get any attendance. Okay.
Okay.
Okay, then no problem. Then, okay, you have written this. We have seen the urinary tract infection. Now we will go to the third one, lipid profile. That is another report. So the normal lipid profile, if you take the total cholesterol, it will be less than 200. That is for a normal person. It will be less than 200 milligrams per 100 ml. Okay, total cholesterol. Triglyceride, it will be less than 150 milligrams per 100 ml. HDL cholesterol, it is 60 milligram per 100 ml. It can be more than that also, but it is 60, it is average. LDL cholesterol, it is 60 to 130. Okay, 60 to 130. Cholesterol HDL ratio 4. So the normal level, it is total cholesterol, it is less than 200. Triglyceride less than 150. HDL, it is 60. LDL 60 to 130. Okay. So you can remember that, and we will see the report. Afnan is there? Afnan, are you there?
Yes, ma'am. Yes, ma'am.
Okay. So please read the report.
Report. Lipid profile, total cholesterol 240 milligram per deciliter.
Hmm.
Low density lipid 180 milligram per deciliter.
Hmm.
HDL
More than.
greater than 60 milligram per deciliter.
Hmm.
Triglyceride less than 150 milligram per deciliter.
Okay. Is it a normal lipid profile or abnormal?
Abnormal.
Okay. Why did you say it is abnormal? Which all points are there?
Okay.
From first point, you can see total cholesterol. Is it okay?
No.
What is the normal level I told? What is the normal level? See the slide.
Less than 200.
Less than 200. So here it is 240. So it is elevated, isn't it? Now,
Yes.
LDL, what is the normal level? LDL, 60 to 130.
Yes.
Here is it more or less?
It is LDL is more.
More. HDL it is 60. Here
Yes.
HDL is
Greater than 60.
okay. Then triglyceride, normal level, what is a triglyceride? Less than 150. Here,
Less than 150.
so what is the problem here? Hmm? What is the problem? What is the problem? Is the lipid profile normal or abnormal?
Abnormal.
Abnormal. So which factor is more here? Whether triglycerides or LDL, which is the factor?
LDL.
LDL. So LDL is elevated, and because of that, the total cholesterol is elevated. So that is 240. So in effect, this is an abnormal lipid profile. Okay. So since and the triglyceride, it is normal, isn't it? It is less
Yes,
than
yes.
50. So it is. So can you suggest one drug that is that can be used for this?
Statins.
Statins. Oh, okay, very good. Yes, we have to give statin because statin it's a best drug for LDL. If it is triglycerides, suppose this is more than 200. So what can be the drug? Okay, I'll ask someone else. Okay, no problem.
Okay.
Femina Najib. Femina.
Yes, ma'am.
I think I asked before also. Okay, no problem. Okay, I'll go to some other person. Shifa TC, Shifa.
Yes, ma'am.
Can you tell me one drug that can be used for hypertriglyceridemia? That means if the triglyceride is elevated, what can be the drug? Best drug. Best drug. Any idea?
HMG-CoA reductase inhibitor.
See, the statin we can use for any type of abnormal lipid profile, but for each factor there are certain drugs of choice. So if you give that drugs, it will be more effective this way. LDL, it will be for triglycerides. Triglycerides actually fibrates and niacin. Okay, so we will. Okay, please write down the question. Now, the answer will be, the questions are interpretation of the analysis, ideal hypolipidemic drug for this person, and which are the primary triglyceride lowering drugs. Please write down the question also, then I'll show you the answer. Interpretation of the analysis, ideal hypolipidemic drug for him, which are the primary triglyceride lowering drugs. So the interpretation, hypercholesterolemia. Second question, ideal hypolipidemic, it is statins, tablet atorvastatin 10 milligram at night daily. And triglyceride lowering drugs are fenofibrate or fibrates you can write, and niacin. Over? Shifati C, is it over?
Yes, ma'am.
I think all have written. I think only that was the last slide. Yes, thank you.